Hello everyone. In this video we are going to learn practically how to perform the rescue maneuver. This maneuver is indicated in situations where the patients complain of sensations of lightheadedness, nausea or visual disturbance following cervical mobilization or manipulation. Now if the chief complaint of the patient is that of lightheadedness and nausea, in that case the patient is going to be made to sit on a straight backrest chair and the therapist is going to stand in front of the patient on one side in a straight standing position. Now from here the therapist is going to stabilize the shoulder and the trunk of the patient by contacting it against the hip joint, whereas the head and neck is going to remain in neutral position, and this is again going to be stabilized by the lateral chest wall of the therapist. The therapist's right hand is going to cradle or stabilize the patient's occiput in such a manner so that the middle phalanx of the little finger is hooked around the C2 spinous process. And now from here, the thenar eminence of the left hand is going to contact the middle phalanx of the little finger, and then a PA glide in the horizontal direction is going to be applied by the therapist. And this is going to be maintained for 30 seconds, and we are going to ask the patient again to tell about the outcome of the maneuver, that is, if this glide is relieving the symptoms or not. Now in situations when this glide does not relieve the symptoms, then the therapist is going to ask the patient, while maintaining the glide, to slowly start extending the neck while inhaling deeply to the point where the symptom starts relieving. And once the patient has achieved a point where the symptoms are relieved, deep inhalation and exhalation have to be performed by the patient for 3 times before returning back to the neutral position. Now this maneuver is required to be performed usually only for 1 time. Now in situations when the chief complaint of the patient is that of the blurring of vision, in that case the therapist is going to stand behind the patient and the C2 glide will be given in the same manner as that was delivered for cervical extension dizziness. So again the contact point here is going to be the C2 spinous process. The thumb of the right hand is going to be placed over the C2 spinous process and the thumb of the left hand is going to reinforce the right thumb. A horizontal glide in the treatment plane is going to be applied by the therapist, and the therapist is going to ask the patient to focus on an object at a distance and look for whether the blurring resolves or not. Now in case when the blurring of vision does not resolve, then in that situation, while maintaining the glide, the therapist is going to ask the patient to start slowly extending the neck while focusing on that particular object until the blurring of the vision resolves. Now the position of cervical extension in which the patient can easily focus and there is no blurring of vision, that particular position needs to be maintained for 30 seconds before returning back to the neutral position, and then only the glide, that is the C2 posterior to anterior glide, is going to be released by the therapist. A therapist can also opt for using a cervical mobilization belt to deliver the C2 mobilization for lightheadedness and blurring of vision. So this was all about the practical demonstration regarding the performance of rescue maneuver that can be utilized in situations when the patient complains of these symptoms after cervical mobilization and manipulation. See you all in our next video. Till then,
keep learning,
keep sharing and stay connected.